Good morning, afternoon, evening, everyone. My name is Anthony Percival, and I did my literature review on the local food environment and its importance in healthy food access and human health. Now, I wanted to do my literature review on this topic because in a lot of my discussion posts or my white papers, I would often bring the focus to disparity on who actually has access to healthy food options and how that affects their health and what factors in society lead um, these disadvantaged populations to having this lessened access. But I realize that I still really only have a surface level knowledge of these topics. So I wanted to use this literature review to kind of do a deep dive of what really interests me in topics of healthy food acquisition and human health. So first, I'll start off with what is a food environment. There's many definitions, but a basic one: the availability, affordability, convenience, and desirability of various foods. So this covers your whether or not there is a store near you, um, if the produce and healthy foods there are affordable, whether or not it's convenient for you to get there. Is transportation convenient? Is the store close to you? Are you able to walk? Is it safe to get there? And then the desirability, which really has to do with like the cultural aspects of food acquisition or food production, food distribution, and how really the community relates to this food environment. Um, a little more complex, the physical, social, economic, cultural, and political factors that impact accessibility, availability, adequacy of food within a community or region. So that takes into account physical barriers, um, the history of zoning in a city, the history of where different types of food venues were put and why, and the political factors behind those. Um, so it kind of gets a little bit more complex viewing it from multiple spectrums. It's kind of a transdisciplinary look at it. And then one of my favorites, because it's the most simple, is just the local definition, which is just the availability of food for purchase near the home, which is really why I included this Google Maps image up here, because I wanted to show my local food environment. This is generally the area I live in, somewhere in this map. And looking at it, I can kind of see bits and pieces of my food environment. I have access to grocery stores. I have a generally safe area that I'm able to get to and from place. It doesn't take me very long. There's restaurants, there's grocery stores, there's fast foods, there's all of these different kinds of food venues that play into making a healthy or unhealthy food environment. And that's where we're going next. Um, so healthy and unhealthy food environments. Your healthy food environment is one where you and your community all have access to these healthy food options, whether it's produce, whether it's like whole grains, whether it's legumes, fruits, veggies, excuse me, all this sort of stuff. In addition, you also have community support programs. These can be anywhere from providing free or reduced lunch at schools. This can be healthy advocacy programs for children or adults. This can be food assistance programs, food banks, food pantries, those sorts of institutions. Um, your unhealthy food environments, this one is probably one you've all heard of, is number one is the food desert. And this is where residents don't have access to convenient food choices or convenient healthy food choices. Um, so this is a situation where maybe there's no grocery stores in your area, or maybe there's a grocery store, but it's 5 miles away and you don't have a car and the bus route takes 30 minutes to get there and 30 minutes to get back. So it's just not convenient for you to get there. And this lack of access to healthy food choices is what results in a food desert. Less well known is the food swamp, and this is an area that, regardless of how many healthy food options are in um, your area is still saturated with these unhealthy food options. And that is convenience stores that sell mostly junk food, mom and pop grocery stores that do the same, gas station convenience, um, fast food restaurants, that sort of stuff. So an oversaturation of that is what leads to a food swamp. So it's almost hard to see those diamonds of healthy food choices in the rough. Um, so why do we study food environments? Traditionally, low-income communities that includes rural and urban communities have reduced access to healthy food. This is also true for minority groups. They typically have lower access to healthy food choices. Um, there are although rural and urban and semi-urban and all of these other areas are affected, there are geographic components that make the specific factors of interest different. Um, this also includes a relationship to income earning, because even if you have a higher income and you live in a lower socioeconomic community, then you still might not have convenient access to those healthy food choices. So income alone might not be enough to push you over to that edge to be able to buy healthy food. Um, Lack of access to healthy food is a causal factor in obesity and linked chronic diseases. You can't buy healthy foods, you are more likely to be obese. You are more likely to develop those linked chronic diseases such as type 2 diabetes. And you can look at obesity rates in the United States, and you can see that like 35% of adults are obese, 70% of children, or 17, not 70, apologies, percent of children are obese. And these rates aren't constant across socioeconomic status. Poor communities are more likely to have residents that are obese or have these chronic diseases. A third reason is that research is mixed. Um, the methodologies used by different researchers are different. The conclusions they've come to are different. And we've seen this kind of research in class in our lectures where it's not entirely certain whether, like, how food environments do affect the options and health of a community. And then it's a complex linkage of political, social, cultural, and economic and health issues. All of these components come together. So we have to look at these food environments and their effects on human health from all of these different standings. So it's an opportunity for a great transdisciplinary approach. Just to go over real quickly, what may make a food environment unhealthy? Um, well, distance to food venues and time. You may not be able to get to a place to get healthy food with the amount of time that you have available. This is exacerbated when you have kids or when you're in school and you have a job. And you also need to take into account that maybe even if cheaper diets are possible that are also healthy, because we've talked about the affordability of pulses and even some whole grains and produce if it's marked down due to any sort of defect or anything like that in appearance. Um, Preparation might still take longer. And using the time that you have to go get this produce may means that you do not have time to prepare it properly. Um, Relative density of healthy versus unhealthy food choices. This is what uh, really results in that food swamp, food desert situation. Purchasing power. Healthier diets are more expensive in most places. And this is a global phenomena. This has been shown in the United States and the UK, in different countries in Africa, all over. And then you have your social cultural issues. Um, you can have communities that may not accept just a healthy food option dropped in. They may have a very specific way at looking at how they um, engage in purchasing food in a community. Maybe they only go to ethnic stores. Maybe they go to health stores. Maybe they go to farmers markets. Maybe they have a community food program where they come together and they cook meals together, and it's more of a concentrated effort among everyone. This also includes stuff like advertising and how stores are organized. This is a cool little graphic to look at. It's just really showing it from like an ecological standpoint, all of the types of factors that really influence food and beverage intake. So on the outside, you have social and cultural norms and values. You have your sectors of influence that involves like government and how marketing has an effect on you. Your environmental settings. What is your school like? What is your home like? And then your individual factors. It's what you choose, what you choose to eat, what your genetic makeup, your knowledge of healthy practices, and all of those come together to really affect what you eat, what you drink, and your physical activity, and how that affects your health as a whole. And it's all part of that food environment. So let's talk about some current research. Um, so Gosh Steer and colleagues introduced a full-service supermarket to food deserts just to see if this increased availability would alter food buying choices. What they found was that the perception of the healthy option increases when the food stores are implemented, but the residents didn't really take advantage of this food source. It's showing that it may not be enough to just drop a store in an area without really understanding the culture of the people. The people continue to shop at where they were used to shopping. Um, so that's something important to consider. Distance to the nearest shopping center. These same authors actually looked at whether or not um, farther away stores with healthier food um, would affect where someone would shop. And they found that distance to the nearest shopping center, whether it be a supermarket or a convenience store, was not associated with where the person shopped, the frequency of which they shopped, how much time they dedicated to shopping, and how much money they spent. So both of these kind of pieces of research come together and say that you can put a supermarket into a neighborhood, or you can decrease distance to shopping centers, but there's probably some third factors in there, some third, fourth, fifth, sixth, seventh, co-varying factors in there that really impact uh, what will allow people and what will motivate people to pursue these healthy choices, if that they're even accessible to them. Some more research. So, food environments and BMI. I'm not going to try to pronounce the name of this city, but Hosler and his group were looking at the different practices of different ethnic groups within a few disadvantaged neighborhoods, and they looked at access to supermarkets and found that the shopping at supermarkets didn't really lower BMI, and some of that can be attributed to the way that supermarkets advertise. Um, the amount of junk food is often advertised and put at the front, while produce may not be immediately in sight. Um, but they did find cultural, just different practices that did result in lower BMI among individual populations. So the blacks in the study who shopped at farmers markets did show lower BMIs, while the whites who shopped at co-ops showed a lower BMI. And the third group was Guyanese, mostly first-generation immigrants, who shopped more at local ethnic stores because they were keeping that diet from back home. And all of these individual like group decisions resulted in a lower BMI, where supermarket access didn't really play too much of a part. Um, Chen and her group looked at how the home food environment was important, and in her study found that the dietary patterns in the home were more significant when had a more significant relationship with obesity than the community food environment. So maybe it is on a more individual basis that we need to examine how people interact with their food environment and how that affects their individual dietary intakes. Um, the density of healthy versus unhealthy food outlets. Larson looked, this is a study from Canada, looking at fifth and sixth graders, and they found that the higher density of healthy food sources was associated with lower risks of obesity, but unhealthy food source density didn't really have a significant relationship. And they came to the conclusion that maybe we're already so saturated with unhealthy food choices that we've reached that point in that sigmoidal curve where you really level out. Um, so maybe reducing unhealthy food sources to a degree might have a greater impact. Um, and once again, I just find this graphic really helpful when you're looking at all the different impacts of the different factors of a food environment on food and beverage intake and physical activity. So a little bit more research, because I know you always want more. Food swamps versus food deserts. What's worse for human health? Uh, Cooksey Sowers and their group found that food swamps have shown to be a greater predictor of obesity for U.S. adults. Their study was conducted at the county level. This is one of those situations where methodology is different, but it's really important to see that maybe lowering unhealthy food options might be better than increasing healthy food options, but it still requires further research. How much does pricing affect fruit, vegetable, and legume consumption? Hethworth and Ahmed, this was a study that was done, it was kind of a global study. But pretty much what they found between low income, middle income, and high income countries was that when you increase the prices of fruits, veggies, and legumes, you had a reduction in consumption in all of these factors of countries. Now, it was different. In the low income countries, you had the highest reduction in consumption, middle income, the middle level of reduction in consumption of fruits and vegetables and legumes. And in high income countries, you had the lowest reduction in consumption. But it didn't really look into low income, high income, middle income individuals in all of those countries. So that would be something also to look into a little bit further. Um, so that's kind of the current research I have to present to you all. But I wanted to talk about research issues, which a lot of these authors talked about in their papers. Um, so the methodologies of these studies was very different. Um, how the authors uh, considered distance, whether it was like a linear location to an area, or if it was in like a 1 kilometer radius, or what classifies as a fast food restaurant versus a convenience store. Did they include fruit and vegetable carts? Did they include farmers markets? Um, all of these factors tended to vary among a lot of these studies, and it was hard to incorporate. I'm assuming it was very hard to incorporate all of those things into a study. But that's one of the issues touted by the majority of these researchers in their discussions. Self-reporting of important data. This it was mainly focused on in a few studies that were considering obesity and BMI. Um, Self-reporting of data like BMI, people are known to underestimate or overestimate. So a more standardized way of collecting that information is probably necessary to get more accurate information. Um, I already talked about the standardized categories of food venues. Um, the research is leaning towards looking at your relative abundance of healthy to unhealthy options. So incorporating that more into research is a good idea. And then more closely examine individual food venues in neighborhoods. Here, I think the important thing is to look at, you need to compare individual diets to the community food environment, because that will give you a better idea of how the home environment may be a greater impact on our healthy food choices or our healthy consumption, rather than only the food community environment. But they're all important and they're all linked. That's what makes researching this topic even harder, which has led me to my conclusion so far that the community food environment is incredibly complex. And there are associations between a community's food environment and the health of residents, but the research is mixed. There are social, regional, cultural, economic, political, nutritional, and individual factors to account for to fully understand how the food environment affects food availability, human dietary choices, and human health. And it's especially important to consider cultural factors. And I'm going over time, but just a few policy implications. Community-led efforts to equalize access to healthy options may be successful. We need to learn from failures. The New York soda ban failed because of a lack of support, and you learn from areas of success. The Bay Area Ecology Center works to develop sustainable urban agriculture programs led by communities. So they control those means of production, distribution, and sales, and that kind of gives them that mastery, that purpose, the Daniel Pink stuff. Urban agriculture in Bogota, Colombia. A lot of parts of the cities are being converted to be able to utilize urban agriculture practices, because a lot of indigenous populations are being pushed off their land, and that cultural connection to that land is still important. And then food retail expansion for health program is really about um, incentivizing grocery stores to change the way they offer fresh produce, change the way they advertise, change where they have placement in stores, stuff like that. Um, Incorporating communities is especially important. They need to be part of that discussion with companies and governments, um, and then work to understand the culture and practice of a community before implementing infrastructure or policy. This is an issue that would be best tackled by all parties involved, not just one or two parties. Um, Back to that transdisciplined goodness. And then incorporating physical activity into community food environment studies is also very important. I'm sorry I went a little bit over time. Thank you all for watching and listening. I look forward to hearing your thoughts in the discussion, and I'm looking forward to seeing all of your presentations. I'll flip through my references real quick just in case you wanted to stop and take a look at any of them.